Madam Chair. As the only pediatrician ever elected to Congress, this discussion about COVID in children is extremely important to me. Dr. Beers, thank you for being here today. Thank you to all of our witnesses. You know, when COVID first hit, data from abroad and here in the United States suggested that children were really only minimally affected by the disease. And the primary reason for closing schools then was their role in transmitting disease to others. But with the highly contagious Delta variant, some children's hospitals' ICUs are now full. So, Dr. Beers, some quick questions for you. Do children get severe disease from COVID?
Yes, they definitely can.
And Dr. Rush just told us a heartbreaking story about Sophia, who contracted COVID at school, gave it to her parents, both of whom tragically perished from the disease. Can children spread this disease to others?
Yes, they can. In fact, the CDC estimates that almost 120,000 children have lost a primary caregiver to COVID.
Oh my goodness. Do children get long COVID?
Yes, children can get long COVID. We're still learning more about that, but they definitely can get it, and it can be very impactful on their lives.
Can you just list a couple of the primary symptoms that they get so people understand how severe long COVID potentially is?
Yeah, absolutely. They can have cardiac heart symptoms. They can have persistent lung systems, neurologic symptoms where they, have trouble thinking, and many of them have really debilitating fatigue and dizziness, where they have difficulty standing up and going about their daily lives. And
we don't even know how long that will last. So, have rates of COVID in children increased with the start of the school year?
Yes, we definitely have been seeing more COVID.
And that difference is different in different parts of the country. What would you say has distinguished schools where there has been lots of transmission from schools where there has not been lots of transmission, since masks have been a very contentious topic today?
Yeah, absolutely. And I think there's really two big things. One is the immunization rates in the community and the school is a contributing, and the other is the presence of the layered mitigated factors that schools implement. So things such as masking, distancing, hand washing, testing, things like that.
Thank you. I would also note, just for clarification, there is a difference between cloth masks, KN95s, and surgical masks. In response to some of my colleagues, I would also mention that studies done with previous iterations of the virus are different from the current Delta information. So in your opinion, given the high number of children who are asymptomatic and still test positive for COVID, is there a role for surveillance testing in schools to keep infectious children home when they can spread it to others?
Yeah, I do think so. I think, this is one of the things we talk about as one of our layered precautions in schools, and surveillance testing can be a really important part of this sort of overall group of precautions to keep children in school safely as much as possible.
Now, just to go down that path, what happens when a child in the classroom tests positive?
Oh, gosh, they have to go home, of course. We hope that they remain well and don't need to be hospitalized, as most children that it will be the case, but they do need to be home for 10 to 14 days.
So best case scenario, they're home for 10 days, which means their parents are home with them for 10 days of missed work. Now, what about all the people next to them, the close contacts? I met with a school principal who has the job of contact tracing. What happens to all of those kids?
Yeah, it varies a little bit depending on whether or not students are wearing masks and whether or not they're vaccinated, but they can need to be home for up to 7 to 14 days if they're unvaccinated and not consistently masking.
So we could have multiple children home, and in middle schoolers and high schoolers, we go to many children home because they're in multiple classes per day. So as we're talking about all of these kids potentially being home just in case, we talked about test-to-stay policies. In fact, that was one of the things that Dr. Hogue talked about. Some schools, including now LA schools, have a policy where if one person in the classroom is positive, those around that person, instead of being asked to stay home for 14 days, actually can just be tested. The whole classroom could be tested every day, and they could stay in masked and with all other safety precautions. What do you think about that test-to-stay policy and what that means for children?
Yeah, I think that can be a really effective strategy to help make sure children are in school as much as possible. Again, it has to be in the context of other important strategies, including vaccination and, at least for right now, masking. But testing can really help us keep our kids in school.
Last super quick question. We've heard a lot about mental health in kids. If we want our kids' mental health to be good, we need to keep them in school. What are the most important things we can do to make sure we keep kids in school to protect their mental health?
Vaccinate anyone who is eligible and wear masks when you are in school.
Thank you.
I think the gentlelady takes